Good morning, everyone. Today we will be presenting a case of prolonged gestation in 3 years old holstein-friesian cow. And this is our outline. Let's begin with the introduction. The protein in this case is a cow named Happy, a 3 years old holstein-friesian female, weighing 560 kilograms, with a body condition scoring 3 out of 5. She is currently in dry period. For the chief complaint, the owner reported that Happy has not calved according to the expected due date and has exceeded the expected calving date by 15 days. From history taking, the second pregnancy artificial insemination was performed with a Jersey side. This delayed calving has only been observed in this cow, and no other cows in the farm have shown similar signs. At present, no treatment has been administered. The cow is able to eat and drink normally. She has been vaccinated against FMD every 3 months, with the most recent vaccination administered on September 10 of this year. Deworming was performed during the die period. For physical examination, heart rate 90 beats per minute with normal heart sound, pulse rate 90 beats per minute strong pulse, CRT less than 2 seconds, pink mucous membrane, RCR 2 contractions per 2 minutes, complete with no pain sign detected. Respiratory rate 32 beats per minute with normal lung sound, no mammary gland enlargement or edema observed, and the teeth are not extended. Other findings were within normal limits. So, the problem list of this case is prolonged gestation. Next, we will move to the initial assessment. Prolonged gestation can be classified into 3 main categories: physiological factors, pathological factors, and other causes. Predisposition can be ruled out as this cow is daily breed, whereas prolonged gestation is more commonly reported in beef cattle. Malnourished dam can be ruled out because the cow is able to eat normally, and no other cows on the farm have been reported to have this problem. Phytogenous toxins can be ruled out as most plants associated with this condition haven't been reported in Thailand. In addition, the farm area is entirely concrete with no vegetation present in the housing area. And these are the remaining causes that cannot be ruled out yet.
For the initial plans, a complete blood count and blood chemistry were performed to evaluate the animal health status. Additionally, ultrasonography was conducted to examine the uterus and investigate the cause of prolonged gestation. Next is the result. Our red blood cell parameters were within normal range. In white blood cell parameters, it shows eosinophilia. Additionally, platelet count and fibrinogen levels were within normal range. No blood parasites were detected. Blood chemistry results was shown slightly decreased AST inside. Ultrasonography was shown uterine enlargement, small placentome suspected, primitus detected on the website, enlarged middle uterine artery on both sides, unable to detect fetus, a mass on the left side measuring around 15 to 20 centimeters, containing a small cavity inside. Next is revised assessment. From the diagnostic finding, the remaining causes that could not be ruled out, there are high milk yield, multiparous cow, male fetus, fetal death and mummification, fetal deformities, placenta insufficiency, infectious such as viral diarrhea virus, Acaban virus, and Bluetongue virus, hypothalamic pituitary adrenal axis disorder, and human error in data recording. For the treatment, we decided to use dexamethasone sodium phosphate as a dose of 25 mg per cow, given intramuscularly for 1 to induce parturition. If calving did not occur within 5 days after dexamethasone administration, dinoprostomethamine at a dose of 25 mg per cow was planned to further induce parturition. And follow-up. Treatment outcome. After 2 days from receiving dexamethasone administration, the cow delivered a 17 kg female calf, and this is that calf. Normal calving was observed without fetal abnormalities. However, retained placenta has occurred. Back to the real-life assessment part, we can moreover rule out some cause of prolonged gestation. Since the calf was female, no fetus was ruled out. Since the calf was born alive without abnormalities, fetal death and deformities were ruled out. Based on ultrasonographic finding and the successful treatment, placental insufficiency and hypothalamic pituitary adrenal axis disorders were ruled in as the most likely cause of this prolonged gestation.
Discussion based on the information so far. Does anyone have any idea of what might happen to this dam and her calf? Let me tell you now. Well, first, think about the mechanism of parturition in a non-modeling cow. Parturition is induced by the several maternal and fetal factors. Initially, fetal cortisol concentration increase, which triggers subsequent hormonal changes and ultimately lead to the delivery of the calf and expulsion of the placenta. But in this case, inadequate fetal cortisol failed to initiate the parturition. Following administration of dexamethasone sodium phosphate, which acts as an exogenous glucocorticoid mimicking the fetal cortisol surge, the parturition process was initiated and the calf was delivered. Retained placenta was also observed, which can be considered as a side effect of labor induction. Although they administered glucocorticoid successfully in the delivery of the calf, the pattern of hormonal changes within the parturition cases, including progesterone and estradiol dynamics, differ from that of spontaneous parturition. Consequently, the mechanism required for breakdown of the fetal cotyledon maternal caruncle interface may be incomplete, resulting in failure of placental expulsion. So, to wrap up, here is the flow chart of what happened in our case. Now let's talk about the gestation range. Gestation range is mainly influenced by fetal growth and genetics. It is longer with single male calf, older cow and side with long gestation genetics, but shorter with twin and female calf. The cow condition as conception and the environment also slightly affect the gestation range. A limited number of reports describe cases similar to this one and suggest possible predisposition to hypothalamic pituitary adrenal or HPA axis disorder in cattle. Fetal pituitary abnormalities have been reported in Jersey, Guernsey, and Ayrshire breeds. Fetal adrenal defects have been described in holstein-friesian and Swedish grey cattle. Combined pituitary and adrenal hypoplasia has been reported in Belgian blue cattle. In the case of Happy, our patient, the calf was born to be a Jersey sire and our holstein-friesian dam. Therefore, this predisposition may have contributed to an HPA axis disorder in the calf, resulting in prolonged gestation.
The example case study describes impaired fetal pituitary function associated with prolonged gestation in Jersey cornbred cow, and overdue fetus in which medical induction of parturition was attempted. Therefore, parturition was induced using pharmacological agents, specifically corticosteroid and dexamethasone. However, after 48 hours, the outcome was the delivery of a dead male calf with several abnormalities. Histopathological examination of the pituitary gland collected from the dead calf revealed an underdeveloped pituitary gland. Case study 2 involved 2 Belgian blue cows from the same farm that had prolonged gestation of approximately 11 months with no clinical sign of parturition. In this case, parturition was induced pharmacologically and delivery occurred 51 hours after induction. However, both calves died within 24 hours after birth. For external examination showed no external congenital abnormalities. However, internal examination showed hypoplasia of both adrenal glands and the pituitary glands. The findings in this case are highly comparable to previously discussed prolonged gestation case associated with and autosomal recessive genetic anomaly. However, fetal gigantism was not observed in this case. Next point is prolonged gestation was presumed to be associated with the placental insufficiency. Placental insufficiency led to a reduction in transfer of oxygen and nutrients to fetus, resulting in fetal hypoxemia. Consequently, fetal growth restriction occurs, then causing to small fetus. As a small size fetus that is insufficient to induce adequate stress response. Consequently, the normal fetal cortisol surge does not occur, lead to failure of normal initiation of the parturition mechanism and resulting in prolonged gestation. To conclusion and help everyone better understand in this case, the prolonged gestation can be divided by two main possible causes. The first is placental insufficiency. This was supported by our findings including low birth weight of the calf and ultrasonographic evidence. The placentome is suspected to be smaller than normal. The second possible cause is the HPA acid disorder. However, based on the clinical diagnostic finding in this case, the placentome insufficiency is considered a more likely cause of prolonged gestation.
Well, and here is our reference. But our presentation is not over yet. This was only the case of happy only for you, the genealogy case. But there is one more thing that I have prepared for you all. So, what is this? Well, over past 3 days, our group has joined Queen's Repeat Royal Veterinary Service, or you guys know as the name สัตวแพทย์พระราชทาน in Lampang, a city in northern part of Thailand, as you may know. We had the opportunity to work with veterinary personnel from the Department of Livestock Development of Growth of Society. Yeah. And to support farmer in Gokar and yeah, and here is me. And the activity included the deworming, food and marketing, vaccination, and the diagnosis and treatment of the sick cattle. And here is me. Like the dog is like accidentally bark at me, but I would like to like back to them. Yeah, and here's us. Well. And we would like to express our sincere gratitude to all instructors of the ruminant clinical rotation for the incredible and invaluable experience throughout these 3 weeks. And last but not least, we would like to thank all of you for your time. And we wish you a Merry Christmas and Happy New Year in S1. See you next year, guys. Bye.